Ezetimibe added to statin therapy after acute coronary syndrome. Definition: the use of 3-hydroxy-3-dimethylglutaryl coenzyme A reductase inhibitor reduces both low-density lipoprotein cholesterol levels and the risk of cardiovascular events in patients with and those without cardiovascular disease. Intensive statin therapy as compared with moderate dose statin therapy incrementally lowers LDL cholesterol levels and rates of non-fatal cardiovascular events. Because of the residual risk of current cardiovascular events and safety concerns associated with high doses statin therapy, 10 additional lipid modifying therapies have been sought. A video about cholesterol animation: stop killing yourself with statin. Application of medicine. Ezetimibe targets the human peak protein, thereby reducing absorption of cholesterol from the intestine. When added to statins, Ezetimibe reduces LDL cholesterol levels by an additional 23 to 24% on average. Polymorphisms affecting NPC1L1 are associated with both lower levels of LDL cholesterol and a lower risk of cardiovascular events. Whether further lowering of LDL cholesterol levels achieved with the addition of Ezetimibe to statin therapy leads to a benefit in clinical outcomes is unknown. The pros: the improved respiratory efficacy international trial evaluate the effects of Ezetimibe combined with simvastatin as compared with than the simvastatin alone in stable patients who had had an acute coronary syndrome in whose LDL cholesterol values were within guideline recommendation. In improve it the addition to statin therapy of a non-state agent Ezetimibe, which reduced the absorption of cholesterol from the gastrointestinal tract, lowered LDL cholesterol by approximately 24%. The cons: the primary efficacy endpoint was a composite of deaths from cardiovascular disease, a major coronary event, a non-fatal myocardial infarction, documented unstable angina requiring hospital admission, or coronary revascularization occurring at least 30 days after randomization, or non-fatal stroke assessed from the time of randomization until the first occurrence of one of the events. A video about statins mechanism of action from patients with high LDL.
We now view atherosclerosis as more than a passive deposition of fat in arteries. Indeed, complex interactions between vascular endothelial cells, inflammatory leukocytes, and cholesterol-transporting lipoproteins, as well as other cardiovascular risk factors, lie at the root of atherosclerosis. Thrombosis causes the most dramatic clinical consequence of atherosclerosis: acute coronary syndromes, stroke, and limb ischemia. Imbalance in plasma lipoproteins, particularly a high LDL, high levels of triglyceride-rich lipoproteins such as VLDL and IDL, and low levels of HDL contribute importantly to atherosclerosis. All cells require cholesterol, and lipoproteins normally function to package this insoluble molecule in a form readily transported in the blood. However, factors such as an unhealthy diet or genetic predisposition overload this essential lipid transport pathway and contribute to the dyslipidemia that promotes
but are also linked to side effects such as kidney failure, liver problems, muscle weakness, or an increase in the risk of diabetes. And they concluded that even those with less cardiovascular risk experienced a decrease in the likelihood of having a heart attack. Researchers recommended even the public health service to prescribe statins to all people despite their side effects. At present, health authorities recommend intake of this drug to people with a 20% risk of developing cardiovascular disease within 10 years. Video about you'll never see statin or cholesterol the same after this.
Talk about statin drugs. Typically, those are something that you're not on for a week to 10 days. I mean, you're on for a long period of time. And when we get the more and more people on there, if those recommendations become reality, what's the long-term effect of that?
Well, so the long-term effect would be more and more Alzheimer's disease, more and more erectile dysfunction, more and more hot flushes of menopause, and more neurological illnesses. Because again, your central nervous system, your nerves, and your brain are made from cholesterol. So when you drive cholesterol into the ditch, the parts of the body that are made from cholesterol will suffer and eventually fail. And see, this is, again, the fundamental disconnect that the MDs bring to the table, the fundamental mistake that they make. They've thrown the baby out with the bathwater because they don't think the body can fix itself. They think that when things go wrong, that's just life. It's only a matter of time until your arteries clog. It's only a matter of time until your knee goes. It's only a matter of time until your appendix goes, right? So just cut them all out, right? That's their solution.
The conclusion,
so they don't
the
understand
of
the genesis
to statin therapy in a stable patient who had had an acute coronary
They don't
syndrome
understand
and who
it.
had
They've mistaken.
LDL cholesterol levels, which guideline
So let's put it
recommendation
this way.
further
The clogged
lowers the risk of cardiovascular
tumor
events.
is not the disease.
event reduction
The
was
tumor is-
consistent with the predict effects seen with statins, even in the range of low LDL cholesterol levels in this trial, and no offsetting adverse events or toxic effects were observed.